Fentanyl overdose deaths in teens tripled over the last 2 years. That's according to the Centers for Disease Control and Prevention. Fentanyl is a synthetic opioid that was approved for treating severe pain, typically in advanced cancer patients. But in today's Your Healthy Family, fentanyl overdose cases are almost always linked to illegally made fentanyl. The current fentanyl crisis falls into two kinds of tragedies: people overdosing on fentanyl because of an addiction to painkillers, and people who have no idea a recreational drug or drug of abuse they're taking has been laced with fentanyl. Teens just experimenting with illegal or party drugs alone used to be the concern for parents. But now,
because we don't know what medications are potentially added to drugs of abuse, that even that first time of use can lead to tragedy.
Emergency medicine Dr. Robert Lamb says because fentanyl comes in many forms, drug dealers are able to lace the powerful synthetic opioid into powders like heroin and cocaine. Pills and even a liquid form can be slipped into nasal sprays, eye drops, and edibles.
It's being added to a lot of drugs of abuse. And we don't really know when it's actually present in a drug of abuse because there's not a certain smell to it or a look to it that would indicate that it's part of a drug of abuse, but it's being added because it's meant to increase the potency of some of these drugs. But the concentrations and how quickly it affects actually is causing a significant amount of tragedy.
Which he says is particularly worrisome for kids and teens because of their size and the way they metabolize substances.
Because only such a small amount can cause such a significant effect to a patient, we need to be particularly careful with children anytime we're dealing with a medication or a drug of abuse.
So how can we prevent overdose deaths in teens? And is there a way to spot a fentanyl overdose? I'm Lisa Greenberg, and I'll show you how coming up in tomorrow's Your Healthy Family.